I'm Lowell Johnson, Director of the Washington County Department of Public Health and Environment. And on behalf of our County Board of Commissioners and all of the great employees in our department, I'm pleased to share this brief video to recap some of our accomplishments from 2015.
In the Department of Public Health and Environment, we are always looking for creative ways to improve how we do what we do using quality improvement. Department leadership recognize the value of ongoing quality improvement and are committed to advancing a culture in which quality improvement is no longer seen as an additional task, rather a frame of mind in which the application is second nature. In 2015, the department completed 4 quality improvement projects, with 5 more in progress. Project objectives range from streamlining inventory processes to decreasing food violations and ensuring that at-risk families and children are getting the appropriate level of services. By abandoning the notion of perfection, quality improvement is a never-ending quest to improve our work. Staff across all levels have embraced quality improvement as a means to advance health and environmental outcomes. Let's take a look at some specific examples of how the department works to protect, promote, and improve the public's health.
"2015 was a busy year for our department. Before we highlight a few key projects, let's take a look at some of our program numbers. Last year, the department issued over 2,500 licenses and permits and followed up with over 3,700 on-site inspections and compliance audits. Department staff ensured the proper disposal of enough hazardous waste to fill 1,050 semi-trailers and oversaw the replacement of failing septic systems, keeping enough phosphorus to produce 200,000 pounds of algae out of the environment. The Women, Infants, and Children's Clinic handled an average monthly caseload of 2,665 families and distributed about 1,000 farmers market vouchers to financially disadvantaged families for fresh fruits and vegetables. Department nurses conducted 5,050 home visits and received 190 new referrals. Continued initiatives have raised breastfeeding rates to 86%, and 260 low-income families received a car seat at no cost. It is through these efforts and many others that the department works to build a healthy community. The Department of Public Health and Environment and the Minnesota Department of Health conducted 7 foodborne illness investigations in 2015. Restaurant employee hygiene, illness logs, food handling practices, and equipment sanitation were reviewed to determine the cause of the outbreaks. Additionally, hundreds of detailed patron interviews were conducted to uncover sources of contaminated food. Corrective action plans were developed for each outbreak to prevent future reoccurrences. In hopes of preventing illness outbreaks before they occur, department staff are continuously identifying risks and improving preventive and emergency response plans to prepare for the delivery of exceptional services. From participating in drills around chemical or radiological releases to establishing flu vaccine clinics and Ebola monitoring protocols, department staff are always working behind the scenes to keep Washington County a safe and healthy community. A core component in promoting our community's health and environment is informing and educating about public health issues and functions. One growing health concern facing the county is the increase in tick-borne illnesses, which have increased 5.5-fold in the past 15 years. To inform the public about the dangers of tick-borne illness, the Get Ticked Off campaign was launched in 2015. Tick identification cards and removal tools were distributed to over 2,000 Washington County residents with its interactive and informative tick booth at various county events, including the county fair. The program also provided 24 Washington County parks with tick information signs at trailheads. In 2015, the department provided schools with various tools and resources to improve student health, environmental stewardship, and school safety. Department staff helped one Washington County elementary school implement vegetable tower gardens, which gave 360 students a hands-on approach to learning math and science while providing valuable lessons in healthy eating and sustainability. Students enjoyed eating the plants after watching them grow. Department staff are helping schools to improve their recycling programs from the classrooms to the cafeteria. Milk carton recycling is just one of the ways we help divert material away from the trash. In 2015, we helped implement milk carton recycling in 6 South Washington County schools, which will divert 600,000 milk cartons each year. That's enough fiber to produce over 2,800 reams of paper. As part of a new outreach initiative, department staff assisted 6 schools with chemical safety projects, ranging from chemical inventory to hazardous waste training. Chemicals that were potentially hazardous were taken to the Washington County Environmental Center for low-cost disposal. As a result of the program, Washington County students and staff at participating schools are learning and working in a safer environment. In addition to providing our youth with the information needed to promote healthy lifestyles, the department also provides these services to aging populations throughout our community. In 2015, the department was happy to celebrate the success of the Oakdale Vital Aging Network. After recommendations to increase their physical fitness, seniors improved everyday activities such as getting up from a chair, walking, lifting, bending, and stretching. Health and environmental stewardship is also promoted within our internal workforce. Over 500 employees attended the Washington County Health, Safety, and Wellness event, where we recycled and composted 84% of waste through our county recycling program, Divert 70. Only 17 pounds of trash were generated for the entire event, which is less than a half an ounce of trash per person. Divert 70 has received statewide recognition for implementing best practices. Similarly, the County Groundwater Plan, one of the few in the state, was showcased at the Minnesota Department of Health Community Health Conference. Elected officials, local public health leaders, and MDH staff were presented with an overview of our strategies to address current and future groundwater issues. The Public Health Accreditation Board is a national nonprofit organization formed to develop and implement voluntary best practice standards for public health departments. Health departments that successfully complete a rigorous application and assessment process receive accreditation. In 2013, we set a goal of becoming an accredited health department. Since then, a team of staff from across the department have been working diligently to prepare 731 documents to demonstrate conformity with the model standards established to ensure the health department fulfills the 10 essential public health services. This past fall, we hosted a 2-day site visit where representatives from the Public Health Accreditation Board conducted 15 interviews with department staff, community partners, and the Washington County Board of Commissioners to assess the department's operation against the national standards. A report detailing the department's strengths and areas for opportunity has been compiled and submitted to the Public Health Accreditation Board for review. The board will vote later this spring on whether to confer accreditation to the department. The Environmental Center is a year-round household hazardous waste collection facility and the location of the free product reuse room. In 2015, 35,000 customers delivered household hazardous waste for recycling or disposal to the Environmental Center or one of 7 community cleanup events, including 1.3 million pounds of electronics. This past fall, the Environmental Center expanded hours to accept waste 31 hours per week. Several one-day confidential paper shredding events were held which collected enough paper to save 1,037 trees. 370,000 pounds of free product passed through the reuse room back into the hands of community residents, including $450,000 worth of recycled paint. Without the free product program, this material would have been sent off for disposal. 2015 has proven to be an exciting year for solid waste management in Washington County. With the vision to increase recycling and get the most value out of our waste, the Ramsey Washington Recycling and Energy Board purchased a waste processing facility in Newport. This joint venture will provide public ownership and operation of the facility and work towards the state recycling goal of 75%. Ownership allows for the exploration of new technologies to modernize the East Metro's trash handling system. By diverting trash from landfills and transforming it into energy, new goods, and compost, Washington County is setting the example of being a leading environmental steward while lowering waste management costs and keeping jobs local. By viewing trash as a resource, we are now able to create a more stable, predictable trash processing system and leave the next generation with a sustainable and cost-effective waste management system.
As you can see, we accomplished a lot in 2015, and this was only a small portion of the many programs and services provided by the department. There is still much more work ahead of us. We are pleased to have you as a partner in public health. It takes all of us working together to create and sustain a healthy community. If you would like to know more about public health and environment in Washington County, please contact us. We're eager to share our story, and more importantly, we're eager to have you join us in making Washington County a great place to live, work, and play today and tomorrow.